Inflammatory bowel disease encompasses two major entities, ulcerative colitis and Crohn's disease. The differential diagnosis of the two diseases is of paramount importance to the optimization of clinical management, as modern therapies and reliable prognostic indices often involve disease-specific strategies. The differential diagnosis is currently based on clinical evaluation in a combination of endoscopic, histological, radiological, and biochemical investigations. However, in about 3 to 6% of all initial IBD diagnoses made in adult patients, a distinctive diagnosis is not possible, leading to the term of IBD type unclassified. In 2004, confocal laser endomicroscopy was introduced, enabling real-time histology during ongoing endoscopy. That is, in vivo histology. Recent data have suggested that CLE enables in vivo confirmation of histological changes associated with ulcerative colitis and Crohn's disease. CLE has been utilized in a few studies to assess IBD diagnosis, disease activity, and prediction of disease relapse. Taken together, these studies have underscored the potential usefulness of CLE in the in vivo diagnosis of IBD. However, no study has evaluated the potential of CLE for the in vivo differentiation of ulcerative colitis and Crohn's disease. The aim of this prospective study, therefore, was to assess the efficacy of CLE to define the differential diagnosis between ulcerative colitis and Crohn's disease. In addition, variables allowing the differentiation of the two disease entities were identified, and a prediction model was developed to enable the in vivo diagnosis of IBD. Background and study aim. The differential diagnosis of ulcerative colitis from Crohn's disease is of pivotal importance for the management of inflammatory bowel diseases, as both entities involve specific therapeutic management strategies. Confocal laser endomicroscopy allows on-demand in vivo characterization of architectural and cellular details during endoscopy. The aim of this study was to assess the efficacy of CLE to differentiate between ulcerative colitis and Crohn's disease. Patients and methods. This was a prospective study involving consecutive patients with a well-established diagnosis of ulcerative colitis or Crohn's disease who underwent colonoscopy with fluorescein-aided confocal imaging. Results. Overall, 79 patients were included, 40 Crohn's disease, 39 ulcerative colitis. CLE findings in patients with Crohn's disease showed significantly more discontinuous inflammation, 87.5% versus 5.1%. Focal cryptitis, 75% versus 12.8%, and discontinuous crypt architectural abnormality, 87.5% versus 10.3%. Then in ulcerative colitis, p less than 0.0001. Conversely, ulcerative colitis was associated with severe widespread crypt distortion, 87.2% versus 17.5% in Crohn's disease, decreased crypt density, 79.5% versus 22.5%, and frankly irregular surface, 89.7% versus 17.5%, p equals 0.0001 for all comparisons. Statistically significant differences were not seen for heavy diffuse lamina propria, cell increase, or mucin preservation. No granulomas were visible. Based on these findings, a CLE scoring system was developed that revealed excellent accuracy, 93.7%, when compared with the historical clinical diagnosis and the histopathological gold standard. CLE could visualize several disease-specific microscopic features, which are conventionally used in standard histopathology to differentiate between ulcerative colitis and Crohn's disease. However, because of the limited penetration depth of CLE, submucosal details or granulomas were not visible. The new scoring system may allow in vivo diagnosis of ulcerative colitis or Crohn's disease.